Hi, good morning, Mr. Scott. My name is Anthony, and I'm from the respiratory care department, and I'm a respiratory care student. So the doctor ordered you a arterial blood gas. So this test is quite different because we will be extracting it directly to your artery, and then the reason why we were taken by this blood extraction is because we will be able to assess your oxygenation, if how well your oxygen move to different parts of your body and your response to the therapy or treatment. So I'm going to wash my hands first, and then if after it's dry, I'm going to wear gloves or even PPE such as goggles to prevent from accident exposure of blood to your eyes. And would you mind if I'm going to stand beside you? I will check first your ID band, and I'm going to assess you. Okay, so once I'm done assessing the patient and checking the ID band, if they're the correct patient and correct site, I am going to explain it to them how to do the test. So first, sir, if you would mind, if extend your arm first like this, and then I'm going to put a tissue roll or even a cloth underneath it to help hyperextend more their arm. And then I'm going to do a modified Allen's test, and then I'm going to let the patient do a fist for at least 3 times until after including the radial and ulnar artery, I will remove the ulnar artery and then notice the blanching of the wrist. And if you notice the test to be negative, we can do it on the other side of the arm. And another thing to note is when taking up arterial blood gas, we have to double check the patient's chart if they're taking up blood thinners or anticoagulants, and also to know if their patients are edematous, having diabetes, and even some details such as which one is their non-dominant or dominant arm, so that we will be able to know if we're with the preferable side to take up blood. So now that I already have noticed that the modified Allen's test was positive in this right arm, so let's assume that this is the patient's arm. So I already did my modified Allen's test to check the collateral circulation of blood. I'm going to prepare the device. So I have to make sure that the needle is here, of course, and then some important stuff such as band-aid, gauze, stopper, and even the safety cap. So first is have to prepare the needle, then make sure that you want to set it with the appropriate the tube. Then we have to remove it, then prepare the stopper in the side, and even the gauze. And then when setting this one up, we have to make sure the bevel is on the safety side and the bevel up. And then when extracting blood, make sure that it is in a 45-degree angle, and then we have to palpate the pulse. And then once you're ready to extract blood, position it properly, and then insert the needle to where the pulse you were able to locate, like this. So once you notice a blood going up inside the tube, and then once you're done, put a gauze on it. Make sure that you are able to press it for about 3 to 5 minutes, or if patients such as taking up blood thinners, it should be more than 5 minutes or more than 10 minutes to apply pressure. And then some situations you should have another set of gauze. We have to remove a little bit of blood, especially if there are clots present or air. And then once you're done, we have to press this one to a stopper, and then remove the needle together with the stopper and throw it directly to a sharp container. And then, for example, if you're ready to throw this one up, we have to cover it with a safety cap. And then there should be, if the pressure you applied is already done, we have to put it a band-aid. And then we have to put the patient's name, temperature, and also the ventilation. If the patient is on oxygen, we have to set it up, and also your initials. And then put it on a safety bag. And also put the sticker on top of it. And if able not to send directly the specimen, it should be put on ice. But as much as we can, we have to send it directly to the lab for them to be able to check the ABG. So once we're all done, we have to reassess again the patient, check their vital signs, and then we have to also ask if